So welcome everyone to the Clark County Medical Society's virtual COVID-19 vaccine town hall, Engage, Educate, and Enroll Vaccine Providers. I'm Dr. Stacy McKeel, and I'm the president of the Clark County Medical Society. We're very honored to bring this opportunity to our members and physician-strong community. In collaboration with the Nevada State Immunization Program, WebIZ, Southern Nevada Health District, Immunize Nevada, and Nevada Health Response. As most of you are aware, CCMS has been very responsible in our mission and diligent in our response to the COVID-19 pandemic. And as we continue to make the COVID-19 vaccine accessible to all of our community populations, we realize that the physician and patient relationship is one of the most valued, respected, and trusted sources in healthcare. As we strive to increase vaccine confidence among our patients, we're being called upon to help serve our patients by becoming enrolled COVID-19 vaccine providers. The purpose of today's town hall is to hear from our local health authority and the Nevada State Immunization Program on the steps and processes of enrolling to store and administer the COVID-19 vaccine. Our goal is to increase the number of enrolled private physicians and group practices, especially in pediatrics, OBGYN, family practice, internal medicine, and all spectrums of chronic disease specialists. We hope that by educating you on the process and identifying myths and barriers, we will help you be able to move toward the benefit of being an enrolled vaccine provider. This town hall couldn't be any timelier, as it comes on the heels of the FDA's approval of the Pfizer-BioNTech COVID-19 vaccine and authorization of emergency use for children ages 5 to 11. So personally, I've experienced lots of hesitancy among patients. And I know that that physician and patient relationship is one of the strongest reasons that we can convince our patients to be vaccinated. I'm very glad to see all of you have taken part tonight and really look forward to having some good information provided by our speakers. So before I introduce our panel, I'm going to walk through today's format. So cameras and mics are going to be muted during the panel presentations. You're welcome to post questions in the chat as the speakers present. And after the speakers have presented and we have answered the posted questions, we'll use the raise hand feature to facilitate and answer further questions. Please keep your questions related to the topic of enrollment in the vaccine program. And I'm very honored to then introduce our panel of presenters today. We're going to start off with Dr. Fermín Legain, who is the Chief Health Officer of the Southern Nevada Health District. Dr. Legain, I'm going to turn this over to you.
Okay, thank you, Stacy, and good evening, everyone. First, I want to say thank you for participating on this meeting. It's very important for us to communicate with you, and also, as Stacy mentioned before, ask for your assistance on the next phase of the pandemic. We have seen through the course of this pandemic that there is a lot of research about communication. Most of those studies come at the end with similar results, and this is that physicians, medical providers are the most trusted source of information when it comes to COVID, and our community believe in our physicians, our nurses, and healthcare personnel, and today we are talking to you because we really need your assistance on helping us get the vaccine to the community, especially now that we engage in this phase with pediatric vaccination for those 5 years old to 11, and this is a very difficult group, especially because of the perception through the pandemic that the children are barely affected by the coronavirus, and then a lot of people question, why should I vaccinate my child? So this is an area where you can have a very positive impact in educating those parents and community members about the importance of vaccination in in our children. I also want to mention that this evening you will hear about a step that that you need to take to ensure that you are enrolled and have the resources you need to provide the vaccine. In addition to these logistical issues, it's also important that you are prepared to provide information in an evidence-based and cultural sensitive way that will resonate with people who are hesitant to get vaccinated or have questions about the safety of the vaccine. And I just want to refer to a really nice experience that we have this morning. This morning we have a meeting with representatives of the African American community here in Clark County. Unfortunately, the African American community is the community that shows the lowest vaccination rates in Clark County. They are about 39% vaccination rate, which is lower than the county rate right now. Clark County has initiated vaccination in at least 71% of the residents. So it's a big issue, the vaccination with the African American community. So today we met with representatives of the church and also business, but there were also some healthcare practitioners from the African American community. And it was a very positive experience because those practitioners, all of them African Americans, they share with us, the interest on contributing to the success of this campaign, and how they wanted to be able to provide the vaccine that sometimes they have patients at the clinics and they initiate the conversation about the vaccine, but at the end of that conversation, they don't have the vaccine to actually deliver the service, and these are missed opportunities. And this is something that we want to prevent, and we want to partner with each one of you to make possible that the vaccine is available, and you can provide that to our community. In this case, especially with the children who are our more immediate target. Stacy, I will stop here.
Perfect. Thank you so very much, Dr. Legain. So I'd like to go ahead and then turn over to Christy Zaginis, who is the COVID-19 program manager from the Nevada State Immunization Program. She's going to provide us a little bit of information about the providers that are currently enrolled to give vaccinations in their office, and also break them down a little by specialty.
I guess it would help to unmute myself. Can you hear me now?
Perfect.
Okay, good, very good. Welcome everyone. Thank you for joining us this evening. I am Christy Zaginis, the COVID vaccine program manager. And I wanted to go over, we've got a slide set here that I can't see, but I'm going to follow along offline. So the agenda, we're going to touch on what our role is at the state immunization program, some provider demographics, enrollment requirements, how you go about enrolling, how you go about ordering, and then other options for obtaining smaller quantities of doses through redistribution. So can you go to slide 3, what we do? What do we do, please? So the Nevada State Immunization Program receives federal funding to manage publicly funded vaccines in an effort to protect Nevadans from vaccine-preventable diseases. We strive for equitable access to vaccines by enrolling and educating providers on ordering, storing, and handling publicly funded vaccines, including the COVID vaccines. Our program works with Nevada's local health departments, hospitals, schools, and private providers to expand access to vaccines while eliminating cost barriers. We also have other stakeholder partners such as Immunize Nevada, who helps promote vaccine knowledge and resources. As Dr. Le Guin said, primary care providers continue to be the most trusted source for immunization information and vaccine recommendations, and we need your help to move that needle when it comes to increasing immunization covered rates to protect Nevadans. Next slide, please, with the pie chart. So as you can see, we have quite a variety of provider types that have enrolled with our program to date. We have 358 providers to store and administer COVID vaccines. 230 of those providers are located in Clark County, and 151 of those report that they serve pediatric patients. And then just another side note, I pulled some data to inform you guys that in Clark County, 51,600 pediatric doses have been ordered and either are on their way or have arrived. And statewide, the ordering was 66,300 doses from this initial first wave. Ordering will continue on an as-needed basis and will be dependent upon uptake. Next slide, please. And I'm going to turn it over to Jordan Price at this point.
Thank you, Christy. Can you all hear me?
Yes, we can hear you.
Okay, perfect. I am offline as well, so I will be following along. So we do have some key requirements for enrollment. The storage, you must have a freezerless standalone refrigerator, so no kitchen combo units, no dorm style units. They can't have the little mini freezer at the top. Each unit does need to have a certified digital data logger. The state can provide one of these if you do not have one. Having a freezer is optional, but it can extend the storage time of the vaccine that you receive. I will go ahead and have Sean put the examples of units that you can use from big box stores such as Home Depot, ordering from Amazon, or Walmart has some options that you could use as well. Those will be in the chat. For Nevada WebIZ requirements, you must have an active Nevada WebIZ account. If you do not currently have one, we can get you established with one. Each location that enrolls needs to have 2 different coordinators, a primary and a backup coordinator. These 2 people will be responsible for managing the vaccine and vaccine inventory in Nevada WebIZ. They will need to go through a training with our Nevada WebIZ trainers in order to make sure that they have the proper knowledge on how to do so. For reporting, temperatures of the vaccine storage units must be checked twice a day on business days. The temperature data must be submitted to the state every month on the first business day to the DPBH AVARS email that's provided. And vaccine inventory must be reconciled in Nevada WebIZ the first Friday of every month at the end of the day. A CDC requirement that we have to follow is that vaccine inventory must be reported daily to Vaccine Finder. That is every day, Monday through Sunday, whether you have inventory or not. Next slide, please. Another key requirement is preparation. The COVID-19 vaccines are reactogenic. Your office must be prepared, equipped, and trained to handle anaphylaxis. Before vaccinating, patients must fill out the screening questionnaire so you can look for contraindications and precautions. Patients must be provided with a COVID-19 vaccine fact sheet that is provided to you in your welcome email after enrollment. After vaccination, the patients must wait a minimum of 15 minutes to observe for reactions and 30 minutes if patient has a history of an immediate allergic reaction of any severity to other vaccines or injectable therapies. To begin the enrollment process, please send your name, email, and phone number to dpbhavars@health.nv.gov. This is how we get all of your information and have someone from our team reach out to you for enrollment and to provide support throughout the enrollment process. The enrollment process does take about 2 weeks, but it can take longer if a Nevada WebIZ account needs to be created or a provider takes longer filling out the enrollment forms or completing the training. To help with the anticipated surge of provider enrollments, for Southern Nevada, we are planning to hold a half-day workshop where we can walk providers through the enrollment forms if needed. We don't have a current date for that, but we will let you know when we have one established. Next slide. This is a preview of what the enrollment link will bring you to when it is sent to you. An enrollment team member will send you a link through email. Once you click on it, you will see this form. You have either the option to fill it out all in one sitting, or you can save and return later. If you do choose to save and return later, it will ask for an email. Please use an email that's monitored regularly. This link does allow you to go back into the enrollment that you started and not start a brand new enrollment. There are 5 surveys, and all 5 surveys need to be complete in order for a team member to process the enrollment. There's section A, which has your organization information. That includes your CMO and your CFO's signatures on both of those. There's a section B that has location information for your facility, so that way we know where to send vaccine to and what populations you serve. There's an addendum to sign, prescribing providers who are able to sign standing orders, and storage and handling. Next slide. The last part is, after enrollment is complete, is ordering. So the coordinators that you list will be added to our listserv, and our listserv is what we use to send out the ordering link. This link goes out every Monday morning, and providers have until close of business Tuesday to place their orders. We currently use the RedCap link to place orders, but we do anticipate having Nevada WebIZ ordering in the future. Orders take about a week after placing to arrive if they are coming direct ship from the manufacturer. Redistribution of the vaccine to receive smaller quantities is also an option. If redistribution does occur, an NSIP team member will reach out to the provider for guidance on how to participate in redistribution. The minimum order quantities for direct shipment are 140 doses for Moderna, 1,170 doses for adult Pfizer, 100 doses for pediatric Pfizer, and 100 doses for J&J. That is all that I have, so I will go ahead and give it back to Christy to give you more information on redistribution.
Thank you, Jordan. So the quantities that Jordan spelled out for minimum dose required for direct ship tend to be a little bit larger than smaller practices can handle. So we developed various options for providers of various sizes to get a hold of basically anything from 1 vial all the way up until just under the minimum direct ship quantity. And so those options are through our staff redistributing. You can submit an order like regular, and we will plug you in with our staff to arrange the logistics of pickup or drop off. The local health authorities are also a depot where you can request doses, and if they have them available, they'll supply them to you. We also have other partners out in the rurals that are generally hospitals with ultra cold storage, so that it extends that shelf life of the vaccine, and then arrangements are made to pick up from those partners. Additionally, we have partnered with the Department of Transportation, so every month they take doses out to the rurals on the route that they drive. And then lastly, we've developed a pharmacy depot program, which there are, I believe, upwards of 140 chain pharmacies that have opted into this program to serve as a depot where you can go to your local pharmacy and pick up smaller quantities of vaccine. Now, with any of these redistribution options, it will require a conditioned cooler and a data logger during transport to ensure that the vaccines maintain the cold chain as appropriate. So those are kind of the options for the smaller quantities. And before I end our section of the presentation, I did want to put out there that even if enrolling with our program and offering COVID vaccine through your office is not an option, you're still a key player in this response, and that it's up to you to give the accurate information to the parents and patients and recommend that they get the vaccine. And even if you can give them resources on where to get that vaccine, you're helping the whole effort. So that concludes our section, and I'll turn it back over.
Excellent. All right. So I'm going to go ahead and then turn things over to Sarah Lugo, who is an MSNRN, and she is the COVID-19 Vaccination Incident Commander with the Southern Nevada Health District. She's going to talk about how to turn barriers into benefits.
Thanks for that. I'm going to go ahead and share my screen here. There we go. All right. Can everyone see my screen?
Yes, we can see your screen. Thank you.
Perfect. Thank you. You probably don't really see this, do you? There you go. All right, so we're going to talk about barriers turned into benefits, and I want to just stress we have a great staff that's been going out and is meeting with a lot of healthcare providers recently to find out what exactly may be a barrier for healthcare providers of them getting vaccine. So I want to start with, if you have vaccine already in your office, this is very easy. COVID vaccine stays at 2 to 8 degrees, and you pretty much have everything that you need. It's just a little more paperwork you may need to fill out for the COVID vaccine to receive that into your office. So one of the #1 things we're hearing all the time is, I need an ultra cold freezer, and that may be a barrier. Well, you're in luck. You don't need an ultra cold freezer. You can keep these in refrigerated conditions. With the Pfizer vaccine that's just come out and the Moderna, they can stay up to from 10 weeks up to a month in that refrigerator. So you do not always need an ultra cold freezer. And as Christy was just stating before, we do have options for you that you can get smaller amounts than what you would need as if you ordered an entire brick for that ultra cold. So we just want to be really clear, you can store them in a regular refrigerator. The second barrier that we're hearing from healthcare providers, and we love hearing these because we need to know what it may be and if there's ways we can get past it and if there's solutions for it, is we're hearing a fear of wasting vaccine. Now, in the beginning when we started this, the vaccine was very limited, and we were trying to get it to very specific populations and high-risk demographics, where we are not necessarily in that same exact situation. Now, we want to be mindful of what we're using, and we want to make sure that we're taking care and doing our best practices with the vaccine and not wasting it, and a large amount, and making sure that we're taking care of it. However, we are not exactly in the same situation that we were before. So when we look at the doses of what we can get out of there, a Pfizer vial holds about 6 doses. The new Pfizer pediatric formulation that's coming out holds 10 doses in a vial. The Moderna is larger. That one holds 14 doses, and the Janssen holds 6 doses in 1 vial. So if you're only puncturing 1 vial at a time, for instance, the Pfizer can be punctured for good for 12, and I believe that the new pediatric dosing that comes out after it's punctured is good for 12 hours after it's punctured. You have a lot of time to use that small amount of doses for your patients that day. The other thing is fear wasting vaccines. I think we may have some concerns with ordering too much vaccine, but as Christy was saying, we've given a lot of options for you where you don't have to order that large amount. You are more than welcome to order just a couple vials at a time to hold in your refrigerator. The third barrier that we're hearing is billing and reimbursement. That does become a concern. Now, I am not a billing expert. I will not pretend to be. However, what we are finding is we're asking is you can bill for the visit. And for instance, if it's a well check, just like somebody was coming to get a flu vaccine, you can bill for the visit as you would normally. And you cannot bill for the vaccine itself because the vaccine is free to you, but you can charge an admin fee on there. And usually your office manager probably has a better idea of what you can and cannot bill for. And one of the next barriers that we're hearing is additional COVID-19 staff duties. So we have 2 beautiful, lovely ladies that can come in and help train your staff. I think we may possibly get a little intimidating with the reconstitution and the different ancillary supplies that come in, but once you start doing it, it's really quite simple. It's another vaccine that you're reconstituting. But we do have staff that can come in and train your staff and figure out a way to streamline it and for the process in your practice to make it easy for you. And once again, that refrigerator storage and handling is very similar to other vaccines in the aspect that it can stay at the 2 to 8 degree temperature range. These two ladies here are Linda McCloskey and Marinella Mescuti. You are welcome to contact them. They are very happy to come out to your office. Now, Jordan, Price, and Christy would be your contacts for actually enrolling. But these ladies here, if you have any specific questions or if you need training specifically for your office, they are very happy to go out, and please just reach out to them. All right, and that is it for me.
All right, so I'm going to start with the questions that are in the chat, and let's see if we can get them, if there are any questions in the chat, if we can get them to the appropriate speakers. Looks like the only thing that we have in the chat so far is the unit information PDF. And then I have a message. First, let's start off with from Scott, and it says, please clarify, vial good for 10 weeks. However, once vial is poked, it is good for 12 hours. Not sure who the best person is to answer that.
Hi, this is Christy. I can take that.
Thanks,
so
Christy.
when the product arrives, it will arrive for just Pfizer. It will arrive in an ultra cold frozen state. For the adult 12 and older, you can place it in your freezer unpunctured for 2 weeks and then transfer it to the refrigerator unpunctured for another month. Once it's punctured, then the hours start counting down. For the pediatric presentation, it will arrive in the ultra cold state and can go directly into the refrigerator for up to 10 weeks unpunctured. Once you puncture it, it starts to count down those hours.
All right. Hopefully that answered the question. If not, please chime back in on the chat. The next question is from Margaret, and Margaret would like to go over reporting again, please.
This is Jordan. I can take that one. So for reporting, we have Nevada WebIZ. That is where you will have access to what we call your virtual refrigerator. So it's what you have, the vaccine that you have in your actual refrigerator, but virtually in our Nevada WebIZ portal that you will have. So for that, you will need to reconcile the vaccine that you have, and that will be due in Nevada WebIZ the first Friday of every month by the end of the day. The other reporting that we have as a requirement is temperature reporting. So on your refrigerator or your freezer or both, you will have a digital data logger, and on that logger, it keeps track of the temperature of the vaccine throughout the day. So you will check that twice a day to make sure that it is still within the temperature range. And then you will pull that data off of the logger and put it onto your computer, and you will send that to the DPBH AVARS email and every month on the first business day. So those are the two main reporting requirements that we have. And then CDC also has another requirement that we follow for vaccine inventory. So it's something called Vaccine Finder, and you can choose whether you would like your facility to be private or public. So if you choose to be public, it shares your information to the public to let them know that you have vaccine on hand. It doesn't say the amount that you have, but it lets them know that that's where they can get vaccinated. But for the CDC purpose, they use it to see how much vaccine we have within the state. So whether you have 0 in your inventory or you have 50 doses in your inventory, you'll need to report that daily, as it would change daily. The other requirement that we have is administering doses in WebIZ. Those need to be reported after they've been administered to the patient within 48 hours of the vaccination.
All right. So next question that we've got is from Emmanuel, and it says, can we bill private insurances for visits and administration? If you want, I can try to wing this one. I feel like I might know the answer. So we can bill private insurances for the administration, but you may not be able to bill a separate visit unless there's a significant amount of work done. If you just have somebody coming in to do the vaccination, it's going to be just a vaccine visit. So it would just be the administration code, just like what you would do for your childhood vaccines, unless they were administered with another visit. Does that sound right to the professionals here?
That's my understanding too.
All right.
Mine as
So-
well. So to add to that, sorry about that. I would also like to add for billing for uninsured, HRSA does also offer reimbursement for vaccinating uninsured patients. So that is another option. You can find that on the HRSA website. You can just search HRSA uninsured reimbursement, and that should get you there.
All right, the next question is from Holly, and Holly would like to know how she finds her web ID. I'm assuming that's part of the WebIZ registration.
Yes, so if you have a WebIZ already established, you should have a login for that. When you create a COVID account, when you do it with us and you enroll with the state, we do give you a separate PIN number. And so that PIN number will be associated with your enrollment for COVID.
All right, and then the last question that I have for right now is, if our clinic is currently enrolled as a COVID vaccine provider, do we need to enroll again for the COVID pediatric vaccine?
No, you do not. The ordering for the pediatric Pfizer will be on the ordering link here soon. Christy might have more details on that.
It is on the link right now. I updated that today. So for orders collected next Monday and Tuesday, you would use the same link to order your pediatric doses.
All right, and the last thing that showed up in the chat, I don't think is a question, but looks like it might be appropriate for Dr. Legine if he's still on the call. This is from H.L. Greenberg asking if vaccination is appropriate for everyone, given that this is such a new vaccine and there have been 454,319 COVID cases in Nevada and only 10 deaths in the under 20 age cohort the entire pandemic. This is a relatively new vaccine, and the testing in children only involved 3,000 kids. VAERS database showed greater than 600,000 adverse events for the COVID vaccine, and I'm concerned that there will be a mandate for kids, and we should be talking about naturally acquired immunity and risk of death.
Okay, thank you. Well, first, there is no a mandate for vaccination in kids in Clark County or Nevada, as far as I know as today. The vaccine is recommended for children based on the studies that the companies completed, the field studies that they completed. And of course, the review that the FDA did, and the ACIP and CDC follow up with that. So the issue with the vaccination in children goes beyond the child the self. Is also about the protecting the community and preventing the further transmission of the virus across the different segments of the community, especially older populations and older people immune compromised who could be also exposed. So it's not just about vaccinating the children, but more importantly, targeting a decrease in the possibility of transmission of the disease in a community. Thank you.
All right, and then one final question, or another question it looks like from Margaret. Margaret asks, can we charge an uninsured patient an administration fee, or can we cannot collect anything at all?
This is Christy. I can take that. No charge can be passed on to the patient. You can bill private insurance, Medicaid, Medicare, and if they're uninsured, you can recoup that administration fee from HRSA, but nothing can go to the patient.
All right. So I'm going to quickly tackle the next question from Dr. Greenberg, whose comment is not really a question, but it says anyone can spread the virus regardless of vaccination status. That's absolutely true. However, patients who are vaccinated actually have less risk of spread of the virus, and the number of patients that are infected by someone who does test positive who has had a vaccine is less. We'll go on then to the next question from Emmanuel. In the pediatric setting, oh, sorry, just jumped. Can we administer to unvaccinated parents if requested? We are concerned with liability in this setting.
I think I understand what he's asking. If you have unvaccinated parent that brings their child in, you are more than welcome to vaccinate them with the appropriate vaccine. So they couldn't have that pediatric Pfizer, but if you were to carry, say, the adult Pfizer, which is for 12 and older, you could vaccinate with that, or the Moderna presentation is 18 and older, or the J&J presentation is also 18 and older.
I'm just going to chime in on that one too. For those who are in the pediatric setting, I would probably err on the side of following what you already do for your parents. If you vaccinate them, for example, against flu, if they're unvaccinated, then probably that would be a reasonable step to take. Might be a little bit complicated if you have to create a chart on all those patients and add them as patients in your practice. So just, I would kind of be careful on that, at least from a liability standpoint. Next question is from Maria, and Maria says, regarding the storage of the vaccine, we got Pfizer and Moderna vaccines dropped off yesterday and put them in the refrigerator. Is the expiration in 30 days or is it the expiration date on the vial?
That will be 30 days from the time starts ticking once it goes into the refrigerator.
All right, I don't have any more questions in the chat. Does anyone else have any further questions for this evening? All right, so really, I appreciate all of you that have taken part tonight, and looking forward to well, one more question. Is there going to be a vaccine mandate in Nevada? This is also from Dr. Greenberg. I don't know that that's going to be something that occurs. I know there were some federal laws that were passed today in that all vaccines or weekly testing are going to be mandatory for all employers with over 100 employees, and that anyone who accepts Medicaid or Medicare in anything outside of an office-based situation is actually going to be mandated to have the vaccine for everyone in their employ. And I'm not certain what this next question is, but is there a position on naturally acquired immunity? Dr. Legane, do you have any insight into that? I'm not sure what organization we're referring to.
I'm sorry, Stacy, can you repeat that question?
Is there a position on naturally acquired immunity? I don't know if you want to reference the recent study that came out.
Yeah, well, I mean, there is no any, I would call a specific position regarding natural immunity. Again, there are a lot of studies going on and publications and recent publications that actually reference to natural immunity and the value of immunization, and still the conclusion of those researchers is that the immunization is very important and is the critical thing to do with the pandemic. And still, on that paper, they recognize the value of natural immunity, but they also repeat that the vaccination provides a longer protection to the community and is the most reliable tool that we have today.
Perfect. Thank you so much, Dr. Legain. So I've got from Sarah Lugo, what is the next step for healthcare providers who want to enroll to administer COVID vaccine?
You can send your name, email, and phone number to dpbh-avars@health.nv.gov. I'm not able to put that in the chat because I am on the phone. If you have any questions or need more information on that, you can email me directly at jprice, that's Price, at health.nv.gov.
And I have put the email in the chat for everyone to see.
Perfect. Thank you so much, Shalon. I appreciate that. So that is our call to action, guys. Step number one, if you have not already done so and you wish to administer the COVID vaccine, you need to send an email with your name, email address, and phone number to dpbh-avars@health.nv.gov. All coordinators who have enrolled will eventually be invited to a half-day enrollment training conference. And this is going to be a to be determined date in the future. So please email your interest as soon as possible, no later than Monday, November 15th, so that we can get registration information out to the coordinators for the enrollment training conference. Again, this is to be determined for the date dependent on the number of enrollees. Is there anyone else that has any questions for this evening? All right, seeing nothing else show up in the chat and no hands raised, I'm going to go ahead and thank all of you for joining us tonight. Really looking forward to having some additional enrolled vaccine providers, and we really appreciate the assistance from all of our organizations and the coordination that we've had tonight. So again, many thanks to the Nevada State Immunization Program, WebIZ, the Southern Nevada Health District, Immunize Nevada, NV Health Response, and on behalf of the Clark County Medical Society, we're very grateful that all of you have joined us. Have a wonderful evening. Thanks so much.